So 3 weeks after starting the pill, her cramps vanished, but so did her libido. 2 months in, her skin calmed, yet the Sunday sadness wouldn't. And when she stopped, she felt like her sleep improved, and then her cycle disappeared for 70 days. So, birth control is about controlling birth and not about regulating her cycles. But today, I want to talk to you about the real details of birth control and what no one prepares you for. Welcome to the Feel Better, Feel Great podcast, episode 173. The real details on birth control for women in their late 30s, what no one prepares you for. I'm Dr. Andrea McSwain, DO and functional medicine clinician. And again, this episode provides education only. It's not medical advice. And it isn't to demonize or glorify hormonal contraception at all. Some women do beautifully on it, but plenty don't. So my goal today is a more balanced, truthful education so you can make decisions with confidence and with your clinician. So if you've ever wondered why your mood shifted after a dose change, or why your libido took a back seat, why your skin improved but your digestion didn't, or why coming off the pill felt like a flood, a fog, or a long quiet, this conversation is for you. Your experience is valid and it's explainable, and we'll do that here. So meet Rachel. She's a 36-year-old physical therapist, one of my patients. She was on the pill when she came to me, and she was really happy with the pill. Cycles were blissfully predictable, right? Her acne had calmed down, but she felt really flat. Less sparkle, less drive. And after her partner had a vasectomy, she transitioned off the pill. Month 1 was energizing, right? You get all those hormones back. Month 2 brought oilier skin, okay, also those hormones back, and mid-cycle cramps. And by month 3, she had a steady 30-day rhythm and better sleep. Her body was recalibrating as her medication of higher dose synthetic estrogen and progesterone were stopped. So here's the clear map for today. 1, what's common in birth control? Okay, this can be mood changes, libido shifts, nutrient depletion patterns, and digestion changes. And then what's common after stopping? Well, the skin and the serum changes because they're getting those hormones that they might not have been getting before. Cervical mucus is returning because that's also hormonal increase when that's present. Irregular cycles can happen because the pill is giving you hormones. So sometimes if you had irregular cycles when you were to take, and that's the reason you took the pill, when you stop taking the pill, you might again have those irregular cycles. And then, of course, fluctuating energy, right? Because again, you're starting to get into some of those hormone rhythms, and that will fluctuate your energy. So, what is normal and what is not, right? Well, what tends to pass in weeks and what deserves a check in, right? So, heavy bleeding deserves a check in, profound mood shifts deserve a check in, and obviously, no periods for more than 90 days deserves a check in, and so does severe pain, okay? Or a lot of pain. You don't have to wonder if your pain is happening and it's distracting you from your life. Let's call that severe pain, okay? But then if it's obvious, if it's very severe pain and you thought you should go to the emergency room, then you should, okay? Okay, so also we're going to talk about a practical support plan. So we want to get those protein and fiber targets in, mineral repletion, so think magnesium, zinc, okay, a skin strategy, and a simple cycle tracking so you know what your body's saying. All right, so staying on your method is a valid choice, and so is switching, pausing, or coming off. If you're preventing pregnancy, right, have your backup lined up before you change anything. So this is really important because I meet a lot of women in their 30s and 40s, and sometimes they are like, well, I'm going to get off the pill, or I'm going to get out my IUD out, right? Or, I'm changing my birth control. It's like, okay, well, what are you going to do for birth control? Because you are still fertile, right? And I can look at their labs and I can have that information. I can show them that they're still fertile. So it's not a desire to not have children anymore or not have any more children, but instead to make sure you have a plan to have, family planning the way that you want it, right? So, if you are switching like from a pill and you decided to go to something more long term, like an IUD, these are the things to consider with your clinician. And then, of course, if there's changes with your partner and they have a vasectomy, well, then you have a consideration there that birth control is maybe taken care of by the man. Okay. All right. So let's walk through this calm and clinical, obviously not scare tactics. Um, I obviously have a bias that I want women to be really connected to their hormone rhythms. I think that brings them vitality and confidence, and they can build off of that, right? It's foundational. So I'm just going to say that is my bias. Okay. And I still, though, know a lot of people are on the pill that are doing well. But I know a lot of people who are on the pill who are being told that they should be doing well, and they're not. And if that's you, that might be more particularly interesting. Or if you're thinking about getting off the pill, then you kind of know what to expect so you can prepare, right? Because knowledge is power. So I'll walk you through some physiologic changes that happen with shifts, okay? And then we look at kind of how that affects our entire hormonal axis, all the way from the brain to the adrenals to the gonads. And that's called the hypothalamus pituitary adrenal ovarian or gonadal axis, right? So HPAO, which is hypothalamus pituitary adrenal and ovarian axis, okay? So that's also said as HPAG, where it's gonadal axis, that they changed the ovarian to gonadal. So if you might hear me say both those things. Anyway, when we shift the brain messaging to the ovaries, and that restarts signaling, okay? And then, of course, why sebum can surge before it settles. And that's because our skin has hormonal triggers. It has a hormonal response. And so often people are aware of that when they're teenagers, but they seem to not realize that when they're older, maybe. But that's because we're changing a lot when we're teenagers. There's a lot of hormones changing very quickly, but there's also hormones changing throughout the rest of our life. So that's where sebum or skin response is going to happen. And of course, how blood sugar and micronutrients tie directly to mood. And I love talking about that because it really matters. And we're going to have some episodes coming up soon. So watch out, because I just really love talking about that stuff too. It really plays into who you are and your hormonal rhythm. So we'll start with the on-ramp, right? What happens in your brain, ovaries, and gut during hormonal contraception, and 3 common side effects that are under-discussed but manageable. Okay. So let's start with the basics, and these methods actually work in your body. Okay. So most hormonal methods turn down ovulation by quieting the brain ovary conversation. So I'll say that again. So hormonal methods. So this is the pill, but it also includes the patch, kind of the NuvaRing, definitely the shot, definitely the implant, and then hormonal IUDs. So some of these hormonal methods will turn down ovulation a lot more profoundly and systemically than other ones. And those are usually the pill, the patch, particularly the pill, the shot, and the implant. Okay. The lower ones are the ring, which is my personal favorite, the NuvaRing. Then you also have the patch. Okay. And then you have the IUDs. So those are a little bit different because they don't involve the liver, circulating through the liver very much. Okay. So again, most hormonal methods turn down ovulation by quieting the brain ovarian conversation. Okay. They replace your natural hormone rhythm with steady synthetic hormones. So estrogen plus progestin or progestin only. So basically, instead of kind of doing this and having your progesterone do that in the month, now you're just getting like blocked. And so you might feel more consistent, but your body is getting a diminishment of those rhythms. And for some people, they're like, hallelujah, because those rhythms are driving me crazy, right? And I understand that. So I want to be able to help you recover those, okay? And but I want you to definitely appreciate what's happening when you're on these hormonal methods for contraception. Okay. So, and then of course, um, um, bleeding on these many methods aren't exactly a true period. They're basically a withdrawal bleed. So the last week of most pills are actually placebo, just to keep you in the habit. And basically, with the ovulation suppression, you don't actually have a true luteal phase, which is like the end part. So then your body just has that lining that kind of gets full, and then it'll slough off kind of that fragile top part of it. And that's a withdrawal bleed. And so you get some bleeding, and then also you might get some bleeding if you go placebo on that pill. But most of the time, the bleeding is just that lining, that kind of fragile part of the lining coming off. So, let me talk method by method in just one sentence, okay? Um, Pill, okay, it's a combined steady estrogen and progestin, so synthetic progesterone, to suppress ovulation and thicken cervical mucus. When the cervical mucus is thickened, it will block sperm from entering. So that's the pill. The patch and the ring do that, but when you don't take them through the mouth, then you don't have the effects of the estrogen on the liver. And so the patch and the ring are less intense than the pill. Okay, then you have progestin only pill or the mini pill. And this mainly thickens the mucus, causes ovulation suppression, varies in by person, but basically progesterone, which is your natural hormone, and progestin, which is synthetic, are similar in that they kind of convince the body that it's pregnant. And so then the body doesn't want any more sperm inside the uterus. So then it thickens the mucus. And so it serves as a way to be like the hormone pregnancy. So your body's like thinks it's pregnant. Then you get hormonal IUDs. So that's often a synthetic of progesterone. So levonorgestrel, and that's Mirena, Chelena, Skyla. These are locally affecting the uterine lining. It thins the uterine lining and it thickens mucus. And then you still have some users that ovulate, but the lining isn't capable of holding that egg in its soil, if you will. So then it's not capable of like continuing a pregnancy. So even an egg that is fertilized will not be staying in that lining with the Mirena or any hormonal IUD. Okay, then you have implant. That's another often progestin, synthetic progestin, and these are strong ovulation suppressions, thicken the mucus, like a pretty strong dose, right? Um, and definitely some progesterone side effects, but I won't get into that. And then you have the injection, which is medroxyprogesterone. And that is a very potent synthetic progesterone, stops ovulation or suppresses ovulation. And definitely there is a longer tail of side effects after stopping the injection. Some people like it because they come in every 90 days and get the injection, right? That's these are the benefits, right? Of these are the things that are convenience, right? That make them doable. Okay, so then we look at the brain hormone connection, right? So what is mood and motivation? So important. Okay, so we just talked a lot about things like that are like very like kind of like matter of fact, right? Like what happens with those sex hormones, estrogen and progesterone, even though it's a synthetic support with progestin. But then we get into mood and motivation. And these are really neurotransmitters. These are like your feeling hormones. And hormones are influenced by and influence serotonin, right, which brings us happiness, dopamine, which brings us joy, and GABA, which brings us like just like a sense of relief, just a very important, nice feeling. And they help us, with the pathways behind mood and focus, calm, and also motivation, actually. So changes can look like this, right? Smoother moods for some, right? Because you're kind of taking off maybe the top and the bottom, and you're kind of finding a little more consistency, all right? And some people, it's very flat and low because they start to the pill starts to suppress these things, right? And then some also have less spark, right? So they feel kind of flat and they don't really have a spark. And you're kind of wondering like what's going on because it's not really often equated to birth control methods, but it is today. So that's cool. All right. And then of course, you want to look at a bigger picture, right? And when we look at kind of altering the rhythms with the birth control methods, which again, sometimes really work well for people, but you still want to know what's happening a little bit in your body. And so we find that nutrients that trend lower with use are your B vitamins. So folate, B2, 6, 12, those are important. We see also those are really important for getting rid of estrogen or waste products, that like old estrogen, and then also really critical for energy and really critical for cognition, focus, mood. Here's a trick. Now, I really, and oh, methylfolate is so critical for cervical health. Oh my gosh, critical. So make sure you get your broccoli in and your broccolini, right? Or your broccoli sprouts, something like that. And then also get those blueberries in. And, sometimes people need supplementation. You can look at the labs for that. It's very helpful. As long as you know the optimal ranges, not the reference ranges, but the optimal ranges. And I'll get into that another time. And then we look at some other things about some of the minerals. So magnesium, right? Zinc. These are really critical for stress resilience, sleep, skin, thyroid function, blood vessel integrity, muscle tone. I mean, so many things. Mood. Another one that's lowered is CoQ10. And CoQ10 is about energy in the cells. And it's a fat soluble vitamin. Um, Let me tell you, know your levels. But a lot of times people use CoQ10 shots to give themselves that boost. And a lot of times people will use supplementation support because they're taking the pill and they know this stuff. And so they want to make sure that they bolster their nutrients because they have a medication that lowers some of their nutrients. And it is what it is sometimes, right? So just so you know, okay, so those are important, but you do want to check those things out, and you want to make sure that you're understanding how these work, because we can see some long-term adaptations for some people. It's not universal, right? So in metabolism, sometimes appetite and insulin sensitivity can shift. Sometimes the gut and the liver microbiome, right? So the gut microbiome and the liver are doing extra work processing, and they sometimes can get either overinflamed, when you'll see usually elevated liver enzymes, or they'll get sluggish. And that's also contributing sometimes to people feeling like they don't really want to eat. They're like, oh, I don't really want to eat anything. I feel like, bleh. That's often sometimes like a really full liver. And that's going to happen more when people are using oral birth controls, because they're going to use the liver a lot more to process those estrogens that are coming from the birth control pill. Of course, long-term situations can include inflammation. Where some people might notice some more joint-sensitive skin and skin reactivity. So, let me know if any of those things resonate with you, because I think some people are having aha moments. And getting it in your figured out when you're in your late 30s is like such a win, because you have still so much reserve, right? Still so much more capable of recovery. You still have gonadal, oomph, right? And that is really important. So if there's some aha moments for you, please share them with me. So because we want to make sure that you're looking at this and thinking about the long game, healthy at 100, right? Healthy at 100. And so we want to make sure all those organs are doing great. So if you also got to say, urgent evaluation if things like new severe headaches, migraines with aura, chest pain, leg swelling, shortness of breath, or vision changes. So if those happen, you want to seek evaluation because something is going on that's like spinning out of control in your body, right? And it may not be the pills, but sometimes the pills can exacerbate these things. Don't be alarmed. This happens very rarely, but you want to be cautious because you want to know, and I'll tell you, if you are, in your even 20s, but if you're in your late 30s, if you weigh in the overweight, obese categories, if you are smoking and you get on a long airplane ride, you are much more susceptible to blood clots in your legs or in your heart. So again, you want to know that. Put your compression stockings on, hydrate, move, like do the things that you need to do if you are susceptible. Okay, that is an urgent situation too, and also just being aware of higher risk issues. Not that they'll happen, but you like, oh, knowledge is power. Okay, so let's talk for a few minutes about why these methods of hormonal contraception can be really helpful for people. So just to kind of check those boxes off, right? And give credit to the fact that people can have real advantages from this medication. And again, it's not your whole life that you're on it, right? You might be on it for a certain amount of time. And if it's working, then you just need to kind of cover your bases to understand, the side effects, because with benefits, there's always side effects, right? You want to be aware of those, especially with the medication. But we do see some real advantages. Obviously, birth control, right? Pregnancy prevention. If you are family planning, you need a family plan, and that is important. Also, usually predictable bleeding, right? They're lighter, usually less cramping for the most part. Um, Lower risk of ovarian and endometrial cancers because you're lowering your estrogen load, and that is lowering how much estrogen dominant tissues are affected. And then, of course, some people use it for targeted symptom relief, right? Acne, or sometimes PMS, PMDD for some users. Now, if you are using birth control pills for PMS or PMDD, DM me, get in the comments something like, let's talk, because check out, I know I have a podcast on this and I'll have more, because that's a pretty big way to, we can fix that. You can fix that, right? And maybe fix is not, well, fix is the word. I mean, you can get into understanding your hormones, your patterning, and you can address PMS for sure. And that's a game changer. That's a life changer, and it's very doable. But anyway, some people are using the pill for that. Let's consider some other options. I'm just going to say that. All right. And of course, some people use it to manage endometriosis and adenomyosis symptoms. I totally understand that. Or stabilize severe cycles. I get that too. But we're going to talk about in future episodes why we can do some more things on this. So this is why many people do well on them, and why right method, right season is a valid strategy. But knowing your options is also really cool, because my job is to educate you and make sure you know what your options are. And then sometimes you might understand how that really fits for you as a recommendation. And then you can reach out to your clinician for more specifics on recommendations, right? But you want to be educated and you want to get options. And that's why we're here. All right. So benefits do exist along trade-offs. And I'm just going to reiterate one that I mentioned before. These are physical risks. You want to know the signs, because if it's not for you, it's for someone else, right? That's always the case. So again, as I said, blood clots and cardiovascular risk. Okay, these are higher with estrogen-containing methods, smoking in age greater than 35, as well as migraine with auras. So We see those problems pop up rarely, but still they do for some people. Okay, migraines and headaches and blood pressure changes can happen in some users. Definitely, if that's you, reach out, DM or put a comment in, and I can address that. Some more details. Tell you the reasons behind it, what's going on. All right, breast cancer and cervical risk. So, data is mixed and it's method dependent, but you definitely want to know your family history and understand your own personal risks and discuss that with your clinician. Um, Definitely. Yeah, the hormone elements in those are really important to understand. So we'll go through those in some future episodes too. All right, so mental health. Yay! Let's talk about it. Let's address it. Let's be cool about it, right? There are mood shifts and anxiety and low mood, okay? Especially when there's dosing changes or with certain synthetic progesterones called progestins, right? So we need to track how you feel. We need to see how in concert you are with your rhythms. But just know that if you are having those struggles, they are real and there's a reason, okay? And there's things you can do to address it. And your hormones can be the key to that. So, pretty awesome. Of course, sexual health. So, lower libido can occur via testosterone suppression or altered sex hormone binding globulin. But that's important, okay? And then vaginal dryness may follow, but vaginal atrophy is a big deal because then we're talking about lower or pelvic floor health, right? And that's something you want to make sure that you just don't be okay with. Obviously, nutrient depletion and why to screen. So, checking out, um, we have a metabolic test that you can do a metabolic test evaluation with us. So we have taking your labs and putting those in, and I will have a link for that in coming soon. So if you're interested in that, just let us know. Just metabolic labs, put a comment in the section, and that can really help us targets for you understanding some supplementation that may be helpful as an option if you're seeing fatigue, low mood, hair, skin changes, or exercise intolerance. Oh, that one's so important. We need to get stronger, right? All can agree on that. So, obviously, there is, moving on to this next idea of like the post pill cluster. So, what happens after stopping? Okay. And that is super important because you've taken a hormone in that's synthetic, it's kind of done some stuff, and now it's going to come out. And you're going to have some recalibration, right? So, and you want to be able to temper those. So you don't want to do that alone. You want to plan, you want it prepared, you want to do it right. So but what can happen is irregular cycles, acne, hair shedding, digestion shifts, and fatigue. Okay. So, um, and obviously just a check-in moment for as a clinician. If you're having new or worsening depression, suicidal thoughts, heavy bleeding soaking through protection hourly or every 1 to 2 hours, severe pelvic pain, no period for greater than 90 days after stopping. Okay, that's important, especially if you're not on a hormonal IUD. Those are things that need to be evaluated. So to give you a word to the wise as a clinician. All right. And then what happens in life after birth control? What happens when you come off and how do you support the transition? Okay. So, what to expect? What to expect are some of the things that I mentioned, right? Ovulation reawakens, cycle regulation, and some of the other things I mentioned. So, we'll look at nutrition and then get you a basic support plan. So, nutrition anchors, you want about 1 gram per pound of body weight. So you look about 70, um, about 100 to 150 pounds. That can be really difficult. I usually recommend females get about 75 grams of protein a day. Now, fiber, 25 to 35 grams, primarily from plants, beans, berries, right? And those support estrogen metabolism. Those are some big goals, but I want to set the bar high. And let's say you get in 60 grams of protein a day. You're doing great, right? So set a goal, and then you work to obtain it, right? Fiber, I like to think 8 grams of fiber per meal. right? For protein, I like to think about 30 grams per meal, and then maybe another protein support in the day. Um, Obviously, we have minerals and vitamins, and we look at those. We're looking at like optimal mag in the evening. Uh, zinc for about 3 months, once a day. So optimal zinc with food, and then a B complex for mood. Omega 3s are critical. So recommended dose for that is 2 to 4 grams. So for optimal omega capsules, that's 2 to 4 capsules a day. And then CoQ10. A pill a day is what most people take. That's what's the recommended dosage. And obviously, some people do injections because it's really nice to feel better, feel fast, right? Feel better, feel great, fast. So, liver and gut support, that's really important. So we see hydration, obviously broccoli sprouts. I super love those. Bitters like arugula and dandelion. That's a good idea. I think I need to get some arugula next time, either at the store or the farmer's market, right? Obviously moving, working on consistent bowel habits if you need to work on them. That's really important. You got to get that stuff out. So, also looking at skin strategy. So we have a lot of those tools available, and I'd be happy to discuss more on skin. So if skin interests you, then put it in the comment sections. All right. And then obviously basic lifestyle stabilizers, sleeping 8 hours a day, strength training 2 to 3 times a week, get your protein in, your fiber in. Helpful really at breakfast to get a good amount of protein in. And then look into that sun, feel that sun, and really help your body connect to the sun to help support your circadian rhythms. Okay. So when to check labs? So if you are, check your labs. When to check your labs is if you're having a problem, you might have to check them more. I would say a lot of times people kind of don't get enough of their labs checked. They get like a few things, but they're not really helpful. But at least annually, right? And if you're symptomatic, you might be looking at 6 months, 6 to 9 months. But you want to, especially, you want to address it, particularly if you have fatigue, hair loss, right? Acne that doesn't go anywhere. Your cycles are extended to 60 or 90 days. You have mood changes, right? So those different tests you can see with CBC, ferritin, which is iron stores, thyroid panel, B12 and folate. Folate is B9. Your vitamin D3, checking, zinc and magnesium, and then going deeper into some hormone testing can be really helpful. So root cause hormone testing can really help you appreciate where your androgens are and where some of your hypothalamus pituitary hormones are. So that can be very, very helpful for you. All right. So I want you to just know that contraception is very personal. Obviously, I talk about a lot of personal things related to health professionally. And there are real benefits, real trade-offs, and real ways to support your body if you're on it or you're off it. So you deserve full information. You deserve education and options, and not fear, and not to believe what you're doing is wrong, right? So the more you understand your physiology, the calmer and clearer your choices will be. So bring your step questions now to your clinician. And if you're transitioning off, consider a support plan, right? Consider knowing more about your rhythm so you can get that hormone rhythm reset. And it's the first place to start with that is the root cause testing. And thank you, thank you, thank you. Please share this episode with your friends, loved ones, especially with a friend who's maybe thinking about getting off birth control, maybe a friend who's thinking about getting on birth control, right? It might be the conversation that they need to hear. Thank you so much. Please subscribe and like and share. All right. Have a lovely day.